Hello, PsychU community, and welcome to today's interview with a new PsychU supporting organization, Potomac Psychiatry. My name is Dennis Sholler, and I'm a member of the Field Medical Affairs team at Otsuka Pharmaceutical Development and Commercialization Incorporated. And I am grateful to be joined by Drs. Bruce Kehr, Rene Stokes, Chuck Ng, and Julie Wendt, who are clinicians at Potomac Psychiatry, which is a full-service psychiatric practice offering genetic testing, nutritional psychiatry, autism evaluations, talk therapy, and more. And that more piece goes far beyond what I can cover in my brief introduction. So Dr. Kehr, I would love to turn it over to you to tell our PsychU community a little bit about Potomac Psychiatry. Through what methods does Potomac Psychiatry aim to treat the whole patient?
Well, Dr. Sholler, thank you for having us. And we like to evaluate and treat each patient as a whole person, not a collection of symptoms. We strive to understand the unique forces and factors that underlie their illness, ranging from genetics to early childhood trauma to underlying biochemical problems. You asked about our methods. The methods we use involve sophisticated laboratory testing, including genetic tests that uncover genetic vulnerabilities and how different psychiatric medications are metabolized. And then we do screening blood studies that look at hormone levels and vitamin levels, things like thyroid, estrogen, testosterone levels, reactivated or hidden infections like Lyme disease or herpes. We're seeing more long COVID patients. Then we formulate a treatment plan, typically involving a combination of psychotherapy along with medication. All of us docs are psychotherapists as well as prescribers. And sometimes we also include nutritional psychiatric counseling as a part of the plan. We have many board certified subspecialists in our practice: child, adolescent, adult, substance abuse and addictions, forensics. We have a developmental behavioral pediatrician. We have a world-class nutritionist and also do many psychological assessments. That gives us the ability to consult with one another on the more complex cases. And every 2 weeks, including people like yourself, we bring in outside experts to educate all of us on the latest findings in mental health science in our brain science breakthroughs meetings.
Thank you, Dr. Kehr. We very much appreciate the collaboration first and foremost and the kind words. And what I've come to appreciate in our time together is that Potomac Psychiatry really prides itself on the uniqueness of root cause psychiatry, something that I'm sure our PsychU community is interested in learning about, and they may be new to it. So, Dr. Kehr, for our PsychU audience that may not be familiar with root cause psychiatry, what is it from, a 30,000-foot view?
That's a great question. The vast majority of new patients we see have seen multiple other practitioners and they aren't getting better. And in some cases, they're actually getting worse despite really good standard treatments. And they end up feeling broken and they feel hopeless, they're exhausted by the entire process and really many times cynical that psychiatry will ever help them. So what we do is we take a different approach in our 12-month outpatient root cause psychiatry program. We use the latest biotechnology to get to the bottom of the root causes of their condition. For example, we can assay up to 750 different genes through relationships with companies like Genomind and Intellex DNA. And then we work up their gut microbiome and their cellular health, their immune system. We're looking for immune system dysregulation. Sometimes we find evidence of latent infections like strep or Lyme or Epstein-Barr virus. We also sometimes look for antibodies to brain tissue itself through tests like the Cunningham panel. And if patients are struggling with long COVID, we also test for cytokines and chemokines. And we never do a test, Dr. Sholler, that we can't do something about when we get the results back. So what we do is we put all the test results into a special database we've created for each patient, so they each get the unique set of data points. And then we not uncommonly find evidence of a lot of vulnerabilities, genetic vulnerabilities to depression, anxiety, OCD, other psychiatric conditions, evidence that we should avoid certain medications or prescribe them at very low doses, things like leaky gut syndrome, problems with mitochondrial energy production, methylation problems, inflammation, even active infections. And based on this database, we then address each of the data points one by one systematically to help evaluate and treat the patient as a whole person. And will not uncommonly bring in outside experts in immunology, infectious disease, neurology, and so forth. We then will have an initial treatment plan that we get underway. We meet frequently with these patients over the 12 months. And then every quarter or so, we'll meet with our outside practitioners. We even now deliver this program nationally to other states. And that way we're able to help other practitioners throughout the United States get the benefits for their patients of our root cause program.
Thank you, Dr. Kehr, for the overview of root cause psychiatry. And it's always been impressive to me, just the assortment of subject matter experts that Potomac Psychiatry is able to integrate to really bring this to life. And one of the topics that you mentioned is the role of genetics and the role of genetic testing. And so, Dr. Stokes, I'd love to turn to you to really dig into this role of genetic testing in mental health. And I'm curious to know, how does Potomac Psychiatry really utilize genetic testing in the treatment of patients with serious mental illness?
Yeah, once again, great to be with you, Dr. Sholler. I must say it's a really exciting time to be in the practice of psychiatry. The field is literally bursting at the seams with new insights and opportunities. And I think the growing field of genetic testing is going to be central to that evolution of psychiatry, and really a cornerstone of our march toward personalized medicine. Historically, I think our field has relied perhaps too heavily on collections of symptoms for disease definitions, and remain fairly limited in terms of our opportunities for intervention, mostly limited to neurotransmitter targets or serotonin, norepinephrine, dopamine, and the like. And so I think with the advent of genetic testing, we really gain clarity on both the disease definition side of things, really elucidating those root cause considerations, and additionally expanding the opportunities for intervention. And so at Potomac Psychiatry, we fully embrace the opportunity of genetic testing for our patients. We routinely look at patient DNA for guidance around single nucleotide polymorphisms, or SNPs, that can make them either vulnerable to disease or uniquely resilient in other situations. And so we're also able to use that genetic testing to guide decisions for medication selection, oftentimes saving our patients from the historical approach of trial and error, which could sometimes lead to disengagement from treatment before ever getting the results that patients desire. And so for me, it's been a real value add to sort of harness the promise of genetic testing. Things that we routinely identify are things like MTHFR status. We gain huge value in understanding the genetic underpinnings for drug metabolism, giving patients real insights so that we can choose with confidence the right medications that they can best metabolize, that has the fewest interactions with the rest of their regimen. And it's really empowering to give that information to patients, particularly around drug metabolism. And I oftentimes tell them to share that, to save that card, because the future of personalized medicine is coming. And I imagine that information around drug metabolism is something that will ultimately be useful to all of their providers. And they really feel pleased to be able to own that part of their story and to bring that to other providers that will care for them. So I say all of that to say it's been an invaluable tool to be able to use genetic testing to support our clinical decisions. And I think that's really the future of psychiatry, and hopefully there'll continue to be more adoption.
Thank you, Dr. Stokes. It's exciting indeed. I mean, I can think back to when I was still doing preclinical research, and we were excited about phenotyping rats for things like impulsivity, to look at transcriptomics and metabolomics, and to see now the potential splash, in psychiatry is nothing short of amazing. And so I very much appreciate that. And with
Absolutely.
that, yeah, with that, I'd love to pivot to Julie to talk about another one of the, I guess, pillars as I've come to know them for root cause psychiatry, which is a nutritional psychiatry, an area that is very interesting to me as well. And so, Julie, what is nutritional psychiatry and how does Potomac Psychiatry utilize it in the treatment of patients with serious mental illness?
I would like to frame it in a way that establishes this relationship between diet, nutrients, brain function, and mental health. So, nutritional psychiatry includes all of those aspects as foundational. So, it's recognizing the relationship between our gut, the microbes that inhabit our gut, and our brain. And there's a specific, we call it a superhighway. There's a specific connection through the vagus nerve that directly links, from a physical perspective, our gut with our brain. And so when we're thinking about how to optimize mental health, we can't ignore what's happening on the other end of that superhighway, right? And so we need to integrate into our approach the analysis of a nutritional approach, what the patient is eating, what they're not eating, how are they meeting their cellular micronutrient needs with those cofactors, vitamins, minerals, what level of polyphenols and phytonutrients are they bringing into the system in order to really allow this architecture to work as it's designed, right? So we take that into account, and as Dr. Kehr mentioned, all of the testing, we're using the testing of the gut microbiome and functional nutrition status to really personalize our approach and be able to say, there's no one special diet that everyone is going to be put on. We're going to look at everything, and we're going to look at your lifestyle and use that as one of our primary tools for helping with the symptoms that you're coming to see us for.
That's amazing to hear and such a unique take as well. And I imagine your job is both vast and challenging, especially when it comes to the diet. I mean, thinking about all of the different options and the different tools you have in your tool belt and how to personalize that for patients based on their specific cases. Just another kind of amazing facet of the work that you're all doing. So very much appreciated. And at this time, I would like to introduce Dr. Ng to discuss really another priority at Potomac Psychiatry, which is the evaluation of developmental disorders. So, Dr. Ng, welcome. And I'd love for you to discuss your role as the developmental and behavioral pediatrician at Potomac Psychiatry and just talk a little about how you evaluate very young children for developmental disorders like autism.
Thank you for having me. So just a little background, because I know many people are probably not familiar with developmental behavior pediatrics. Developmental behavioral pediatrics is a board certified pediatric subspecialty. Developmental behavioral pediatricians have evaluate, counsel, and provide treatment for children and adolescents in a wide range of developmental concerns. All developmental pediatricians have to complete a residency in general pediatrics, which is very important because we deal with young children and it's important to know what is typical and atypical. And then they complete a fellowship in this subspecialty. We typically diagnose and manage disorders such as developmental delays, learning disorders, behavioral problems such as school avoidance and sleep disorders, and neurodevelopmental disorders. I had the privilege to train at Cohen Children's Medical Center in New York, so it's afforded me a wonderful experience working with a diverse population in Queens, New York, and with complex medical disorders. My practice here at Potomac focuses on the diagnosis and management of neurodevelopmental disorders, neurodevelopmental disorders such as autism spectrum disorder, anxiety, tic disorders, and attention deficit hyperactivity disorder. Autism spectrum disorder is a neurodevelopmental disorder that typically affects children early in development, as young as 18 months, which is why background in pediatrics is very important. And that's what I kind of bring to the practice. My evaluation for autism includes several components. The initial step is to have parents and teachers sometimes complete rating scales to assess symptoms. This is important to make sure that we capture all the different symptoms because many of these disorders are not mutually exclusive and you can have multiple. These rating scales are standardized and validated measures that allow us to identify signs and symptoms of various disorders that the patient may be exhibiting and the parents may not assign to a correct disorder. I would then conduct a structured interview and comprehensive interview with parents to obtain a clinical history. And the last component would be either an observation for parent-led activities for young children, which is called the tele-ASD-PEDS, or IQ testing for older children. The tele-ASD-PEDS involves a semi-structured activity that I would guide parents to perform with their children. These activities allow me to observe how children interact in their home setting with their own toys and their parents, which is a more natural approach. I find this to be the most accurate way to observe a patient's natural behavior without combining variables such as being in a new place, being with an unfamiliar adult such as myself, or using toys that may not be accustomed to playing with. The IQ test is recommended for any child that's being evaluated for autism, but may only be appropriate for children a little bit older, 4 and older. And that allows me to interact with them directly in an appropriate way to see how they answer questions and can maintain an interaction. With all these measures, I'm able to make a diagnosis of autism spectrum disorder with a high degree of confidence and reliability. And this is why I've joined the practice, to help give Potomac this kind of specialty.
That's great. Thank you, Dr. Ng. And I imagine it also must be challenging work. I had a conversation one day with a psychiatrist just talking about the treatment of children and young adults. And I imagine, integrating, like you had mentioned, not just from your patients, but from their parents or from their teachers or their school counselors or all these different sources. I think, we're very much looking forward to hearing about your role developing at Potomac Psychiatry and hopefully spotlighting some of that on PsychU as well. So thank you very much. And speaking of that, would just like to say a thank you to all of you for bringing Potomac Psychiatry to life for the PsychU audience. And Dr. Kehr, I'd love to turn it over to you for some concluding remarks. And in particular, I'd love to hear, what excites you the most about working with PsychU.org in the future.
Well, we really love what you're doing, and the in-services you provided for our staff have really been invaluable, because we're trying to stay at the cutting edge of psychiatry and neuropsychiatry and the immune system. And you've brought such brilliant, focused presentations to us about that in the series you've been presenting. And it actually gets us a lot more excited, because first of all, we feel that we can, thanks to you, be at the cutting edge. Secondly, it gives us tangible ways that we can help our patients. Gives us all sorts of new ideas about diagnostic tests we can offer, and then treatments that can follow based upon the diagnostic testing. And then I think the other thing that's really valuable is the content creation that you and your colleagues provide, not only for our own education and elucidation, but also we really strive to give back to our community by giving high quality content on our website, and to now recognize that we don't have to create all that content de novo, which is very time consuming. We're now able to borrow, as it were, the content that you've created and be able to repurpose it and use it for our own community. Really adds a whole other layer of value to people, not only our existing patients, but people out in the community are really, we're read around the world. Our blogs are read around the world. So be able to offer that kind of content globally really means a lot to us. So we want to thank you for that.
Thank you, Dr. Kehr, for the kind words. And of course, it goes both ways. We're grateful to have you and to learn from just how you're innovating in the field of psychiatry, and to be able to cross-pollinate those ideas and then to share them with the PsychU.org community and with your communities as well at PotomacPsychiatry.com. I think just improves that overall education for our mental health care community, and quite a privilege that we can both be a part of that. So of course, we're very much excited to continue to collaborate with you all as a supporting organization. And so with that, I would like to say for our PsychU community to keep up with the work that Potomac Psychiatry is doing, you can visit through 2 ways. The first would be to go directly to www.PotomacPsychiatry.com, or you could go to the supporting organizations tab of PsychU.org and you could locate a direct link to their website. So we'd just like to say thank you again to the team at Potomac Psychiatry for your time and for offering your expertise to the PsychU community. And again, thank you to our PsychU community for joining us for today's interview. And of course, we look forward to telling you even more about Potomac Psychiatry in the near future.